Is there any of your family member, relatives, amongst the neighbor who is suffering from motor neuron disorder, multiple sclerosis, cerebral atrophy, or cancer, tumor, cyst? Then this video is really going to mean for you. This video will really add a value in your medication. So I request you all, please watch this video till the end. Namaste. I am BC Adhikari. I am a doctor of neuropathic medicine and a senior neurotherapist. As in my last video, I told you that I'll keep on telling you the medication what you can give by sitting at your home to the MND patient. So this today's treatment you can apply to all these diseases, whatever I have mentioned there earlier, that is MND, MS, or the tumor, cancer, whatever it is, that you can apply. But you need to apply it initially for 10 days, not more than that. And yes, this growing children, it should not be given. It should not be given to the children below 18 years, and the ladies, those who are pregnant, and those who are planning for the babies. Yes, yeah, some of you must be thinking that why I'm making this video in English. Actually, what had happened that as my last video on MND, I received various calls from various places. Many of like this, Kerala, Karnataka, Mexico, Spain. The people says they are not familiar with the Hindi, so they were not able to understand what I said. But since there are limited number of the treatments are available for these diseases, so this really added the value. And since they have applied that oxygen treatment in their home, and they might have got the benefited, that's the reason that they have all called me. On the request of them, I am making this video. This will be a mix of both Hindi and English. Yes, we are talking about this treatment part, because I am not going to get into the scientific part of that, because that I have already discussed in my previous video. Yes, treatment part I am going to tell you. I am going to teach you today the treatment to PAN. Yeah, PAN, PAN stands for pancreas. You know that pancreas, when it comes to in mind, that many of diabetic patients are quite familiar with this, that this pancreas releases insulin. But yes, it's true, but it's not the complete true. Actually, pancreas is a gland which has got a very good function, unique function. It works on the endocrine way, and another one it has exocrine functioning. One way it is releasing the enzymes, another way it is releasing the hormones also. So here today we are talking about the hormones, or that too only one hormone I am talking about, that is somatostatin. See that more or less there are three types of the cells there in pancreas. One is alpha cell that releases glucagon. Second one is beta cell that releases insulin. Yes, today we are talking about the delta cell. Delta cell releases somatostatin. This somatostatin is a very, very powerful hormone. Yeah, this is also being released by the hypothalamus. Yeah, what is the action of this somatostatin is, that stop the growth of any unwanted thing in the body. These are the unwanted thing, anything which is go beyond the control, beyond the limit, then somatostatin release, and it immediately stop the growth. It works by regulating the enzymatic pathway and calcium channels. This is what is the mechanism of action, and that's the reason that it is very, very beneficial for the patient of multiple sclerosis, motor neuron disorder, atrophy, especially elderly patients, not younger patient, and this cancer, tumor, cyst, in fact lipoma. There are many diseases. It is really powerful. So today I am going to tell you how it has to be given to your patient by sitting at home. You need not to go anywhere. So just come to me. I am taking you in my OPD. Here I'll tell you how it has to be given. So right now we have got the two patients in my OPD. So one is of their motor neuron disorder, that I'll introduce him also, and I'll tell you how to be given. Yeah, please come. Now meet Mr. Bachitar Singh. He's very smart, dynamic and a fantabulous personality and मतलब बिंदास पर्सनालिटी. वो लोग क्या कहेंगे उसको, वो फिल्म में क्या देखा, ऋषि कपूर को जानते हैं आप, एवरग्रीन हीरो, लवर बॉय, जो 18 साल में भी हीरो का रोल किया और 60 साल की उम्र में भी लवर बॉय बना. सेम वही. एकदम कैसे हैं आप, ठीक है? ओके. Look, it was just a joking. You know that he's suffering from motor neuron disorder. He's a highly educated man. In fact, his entire family is highly educated. Even then, this disease has snowballed. You know that this disease out of 1 lakh, you would get at least 3-4 patients out there. It's 0.0001%. This is the rarest of the rare disease, and unfortunately, he's part of now. Suffering from this disease. Look at this articulation at his eyes, his legs. देखिए सूख के कैसे हो जाते हैं. This is a muscle wastage of muscles. This is absolutely a muscles loss. Look at this. यहाँ पर भी देखिए ये गड्ढे थे, ये गड्ढे धीरे धीरे अब थोड़ा सा इम्प्रूवमेंट आने लगा है इन जगहों पे. ये एमएनडी की पहचान होती है. दिस इज़ वेस्टेज ऑफ द मसल्स. यहाँ पर पूरे गड्ढे हो जाते हैं, ये पूरे बिल्कुल ये ऐसे हो गए थे. अब नाउ स्लोली रिकवरिंग. वी वॉन्ट से दैट आई एम अ परफेक्ट मैन. न्यूरोथेरेपी कैन गिव द आंसर ऑफ द एमएनडी, बट अप टू मैनी एक्सटेंट इट गिव द सिम्टोमेटिक रिलीफ. बट यू नो दैट दिस डिसीज is such a such painful. It makes a life miserable of the patient. In fact, patient is not only the sufferer, his entire family is sufferer. क्योंकि परिवार में अगर एक सदस्य बीमार हो जाता है तो पूरा परिवार डिस्टर्ब हो जाता है. Now I am going to tell you कि what kind of the treatment you can give to him. Okay? आप देखिए. What you need to do is first you need to fix a pillow under his thighs so that he should not feel the pressure. Now what is to be done? This is his groin area. You know that this is the cut of groin areas. From here you need to have a 2 finger gap. 2 finger gap is, this is the place. This is the right place of the pen. Same way this side. Now what is to be done? That you need to press it for 6 seconds. 1, 2, 3, 4, 5, 6. This is one pen. Again you need to press for 6 seconds. 1, 2, 3, 4, 5, 6. This is called 2 pen. This is 2 pen at the interval of 1 minute. That you will have to give it 6 times. Means 2 pen into 6. 2 pen, you give 2 pen, have a break of 1 minute. After that 2 pen, then have a break of 1 minute. So by this way you need to have it for 6 times. Okay, this will release very very powerful hormone of the body, that is somatostatin. This will immediately stop the growth of the any excessive things in the body. Okay, this is very easy. It will not take too much time, but only 6 or 7 minutes it will take. But it has to be repeated at least 4 to 5 or at least 5 to 6 times in a day for 10 days, not more than that. See that I have got one more patient here. This is a cute baby. You see that she is suffering from cerebral palsy. She is also taking medication, but I cannot give this treatment to her. You know why? Because he is a growing baby. He is an elderly patient. I can give this treatment to him, but I cannot give this treatment to this baby. Okay, so this is what and with this I request you, please spread this video, because though it is the rarest of the rare disease, but it may help to anyone. So please circulate this video to the maximum people of your relatives, neighbors or your friends, so that knowingly or unknowingly you are helping to a patient. With this, thank you very much. Since at the end we always pray to God for the well-being of all. So सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः. and Jai Hind, Jai Bharat.